Good afternoon, guys. It is March 1st. It's day 3 post-op complete abdominal hysterectomy with right side oophorectomy. So I wanted to touch base with you guys since I'm feeling fairly decent and I have a moment here to talk to you about what took place Friday, Saturday, and Sunday. I wasn't able to really feel like doing my post-op days in the hospital, so we're going to do 3 days out. Maybe 6 days out, maybe we'll do it like that. So Friday, February 26th, I went in. I was the first case on docket for my complete abdominal hysterectomy. The plan at that time was to keep both of my ovaries. I went in the day before I did the bowel prep. It was a clear liquid prep. I followed instructions as it was, and that was quite interesting of an experience, but made it through and made it to the hospital without any issues, major issues. Get to the hospital, and I was the first one on the schedule, so when the anesthesiologist came in, I needed to speak to him about my options. I had some options because it's not done just one way or the other. And a few days prior, I had talked to my doctor on about how I wanted to approach my pain care and just how the procedure would go with either anesthesia or blocks, like spinal blocks and things like that. I was possibly thinking about having a spinal block, and then they would do a lighter sedation versus general anesthesia. And she, I think, had planned on doing general anesthesia with what is called a tap block. And from my understanding, it's like a femoral block. They use that a lot in hip surgeries and knee surgeries. So kind of almost put the schedule a little behind on Friday. Talking to the anesthesiologist, he wasn't being quite clear and direct. Of course, they can't give their thoughts and opinions, just their medical perspective on it. So I ended up deciding to go with general anesthesia and a tap block. And the tap block is where they insert, after they put you to sleep, with ultrasound, guided ultrasound, they find your nerves and it's, I believe, post-surgery, before you go to recovery, to help with pain control in that area. So I get back, and that kind of was like a crazy day. Surgery was crazy. There was people hustling, bustling. This was not like any of my other two experiences where it was very calm and chill and quiet. This is kind of a hustle and bustle situation. Doctor came in. We decided, what I decided for my anesthesia and things like that. So we did anesthesia, general anesthesia with the tap block, signed my paperwork for the surgery, and off I go. The nurse had started an IV, and I get to the OR, still awake, and they get me into the bed, and all the nurses and the nurse anesthetists were just amazing. She came in and talked to me as well, besides the anesthesiologist. I had a certified nurse anesthetist, and just a really good team. I can't say enough about the team from the beginning to the end for everyone that helped with this and took care of me. They had troubles with the IV that was placed before they took me to the OR. So because as soon as you get into OR, they start pushing medication. Well, it wasn't going, so they had to pull that, and then I had nurses poking on my IV or on my veins, trying to find another IV or vein as soon as possible to get a good clean IV. They ended up going on the crook of my right arm, which they normally don't like to do because you bend your arm a lot, and my right arm's dominant. They drew blood from my left arm, so it was just a little bit of a hot mess, and it was a little overwhelming because I had all these things going on around me right before they put me to sleep. As soon as they got that IV in, I was gone. I just remember all the hustle and bustle trying to find the vein. Once they found the vein and they got the IV in, I was sleeping. I don't remember anything after that. I wake up in recovery, and I don't remember a whole lot in recovery, just the fact, in and out. We had a lot of problems with pain control. I ended up being in recovery 4 hours because they had to give me narcotics for pain control, and they can't take you to your room until it's a period of time after they give you the narcotics. It's just procedure and protocol. So every time they push narcotics to help with the pain control, as soon as those narcotics just barely started wearing off, I was a little bit of a problematic patient. Extreme pain. I had the anesthesiologist come in. talked to me some more afterwards. You know, once the anesthesia itself wore off, I became quite clear from that. And then a couple hours later, the doctor came in, and then she had a pretty busy schedule, and talked to her once my head was clear. Pain was still a problem. So the nurse that was down in recovery was amazing, very helpful, and we tried all sorts of different things. And finally, we got 4 hours later, which is not common. Usually you're in only recovery like an hour maybe, just a little bit more. And they try to get you up to your room to get you as comfortable as possible. This was about 4 hours later, which is not common. So we finally pushed that last round and get me up to my room and get me settled and switched me over to the nurses on the floor that had been waiting for me for about 3 hours. And family and friends were a little worried because they didn't quite know what was going on. There was a lot of hard time with the cell phones not connecting well in the hospital, which can happen. But anyways, got up to the room, got settled, and was fairly okay at that point. Mid-afternoon, I was in and out of it, but closer as the evening came on, my body's got narcotics in it. It's burning through anesthesia. I'm getting pain medication at this time. I'm getting anti-nausea medication. I've had that tap block. There's a lot going on mid-afternoon on Friday into the evening. Of course, Mark was there, and my daughter was there. So later on, I just remember coming in and out of it. I was just like constantly in and out of it with nausea and pain. It would get under control. The meds would wear off, and I'd have the nausea and pain would come back quite brutally. And so we just tried to keep everything under control. My daughter finally left. She was getting a little concerned because, like I said, I don't take even over-the-counter pain medication. So that's my biggest concern, is just the amount of narcotics and pain meds that I had in my system that my body was not used to at any given time, for sure. So once she left, and then Mark decided it was time for him to go home, I was having a lot of problems at that time with pain in the side body, which was from the tap block wearing off, where it felt like someone was squeezing me on each side of my body. We were trying at that time, we were trying two different anti-nausea medications, which was Zofran and Phenergan, and then that didn't really work, and I was still on narcotics for pain control before they switched me over to liquid Tylenol and Toradol, IV and liquid Tylenol, and then Phenergan and Zofran to help with nausea and vomiting, because you don't want to be retching and vomiting when you have an open abdominal incision. Well, as the night progressed, in and out of sleep, I ended up wrenching, severe nausea and vomiting. So finally the nurse, and plus I was having issues with my bladder. They had removed the catheter, so I was having issues on getting my bladder to wake back up, so I had to have the nurses come in. They helped me relieve the pressure. They do a quick cath is what they call it, and they said that kind of helps wake the bladder up, which it did. And the nurse called the doctor that was on call, and we tried Reglan, was the third anti-nausea medication, which finally worked. I think I had 1 or 2 rounds of that consistently, where that nausea and vomiting was finally controlled, but now, of course, I have extra discomfort from not only the tap block and the surgery, but the wrenching from getting sick. By morning time, like I said, I think about 3 hours total sleep, maybe, because I'd put my watch back on Saturday. And by the time the morning came around, and by the time Mark got there after driving from Saginaw, he had a little bit of a drive, my bladder had definitely woke up, because it was consistently, I was having to get up and use the restroom every 20 to 30 minutes, and then it went down to like almost 15 to 20 minutes. I was constantly getting up and feeling like I had to empty my bladder, because that pressure is more intense because of the incision and from the surgery, and because you have organs that are now gone. Your internal parts that are left have to figure out who's going to go where and settle in. So that's going to be taking place over the next few weeks. Like, the organs have to reconstitute and find a place and settle in, because organs that have been there my entire life are now gone. So before I get into Sunday, I forgot this. When the doctor came in to talk to me, she told me that she was not able to stop the bleeding when she separated my ovaries from my uterus. Apparently, my ovaries were sitting like almost right next to my uterus. So I think she said she started with the left side first and had some issues with, but she was able to stop the bleeding on that one. And then the right side, when she tried to separate it, because the plan was to keep both ovaries, she had told me that I had lost that one because they could not stop the bleeding in that ovary, so they had to remove it because they don't want to leave it in there, and we don't want internal bleeding or anything. So I only have one ovary, which is still good, which means it's not going to throw me 100% into menopause or anything like that. I still have hormones. Hopefully that ovary decides to continue to do its job for a few more years. But as we age and get closer to menopause, because I am perimenopausal, it's already started to slow down in its hormone production. So hopefully it will continue to give me some support with hormones so I don't have to start looking into any type of HRT, which again, I try to not worry about like medically induced HRT, hormone replacement therapy. If that comes to case, I might look at alternatives or bioidenticals. But again, I won't worry about that until that time comes, if I have some problems that are unmanageable. So we had Friday. Saturday was much better. Once the bladder settled down after I woke up, I was able to rest a little more. There was a little bit more movement, which is good. They want you to move around. But again, we have to be very careful of movement. Again, you just had surgery. You want to move, but there has to be safety and to a degree. So Saturday was a better day. I had less assistance from the nurses. The nurses didn't have to come in, just do their their vital checks. I think it's every 4 hours, and then medications, constantly rotation. On Saturday, I was able to be put on oral meds. So they were able to take me off of the fluids and off of the liquid pain meds and then put me on oral meds. And I was able to start eating some food. So I started slowly with some iced tea, some dry rice cakes, and eased into a soft lunch, like a creamy hot cereal. And then for dinner, I just tried a piece of chicken breast with some potato. It was pretty basic, pretty light, pretty bland. Had a lot of gas, which is good, but it can be very uncomfortable, again, with abdominal surgery. And just not taking anything, just sticking to what they're prescribing me until I go home. Then I, talk about getting into my supplements again. That helps with that. So that was Saturday, and the plan was to stay another night because I had such a rough night Friday night. I wasn't trying to be a hero. Doctor said I was more than welcome to stay, and I'm like, let's just stay another night. Give me another day here for you guys to help me before I go home. So that's what we did. Sunday was much better. It was even better yet. Movement, and the pain is just, it gets a little better, but it's just always there. There's always some type of discomfort or tightness or pain or stabbing or just difference. There's things that are different, and just figuring out if it's good, if it's okay, if it's just part of the healing process. And, have questions, ask the nurse, ask the doctor, things like that. So Sunday, I decided to have a little different breakfast. The food was not the best. It really wasn't. So I had like an omelet with some mushroom and tomato. That was it. And like an English muffin with some whipped butter. And again, iced tea. I didn't do coffee in the hospital. I did iced tea. It would seem to taste well. And the caffeine also helps with the stimulation of the kidneys and the bladder. So that was kind of my idea on that as well. So Sunday, that was breakfast. And then so for lunch, what did I do for lunch on Sunday? Again, in between, I'm eating a lot smaller meals than I was before because, again, everything needs to wake back up. And so it's going to be more frequent, smaller meals. What did I have for lunch? I don't remember. I didn't. Oh, I was coming home. So that's what it was. I was coming home on Sunday. Sorry, guys. Took me a minute. So I had my rice cakes for snacks. I had an orange. I had some fruit to snack on. So I came home, and once I got home and I was discharged, I had homemade chicken and vegetable and rice soup that I had made before I went to the hospital, and some toast, some Dave's bread with butter. After that, yesterday afternoon, I probably had, and some just more toast. So I didn't really eat really heavily, just, more carbohydrate-based foods because of all of the medications that I'm taking. I'm not going to be a hero on doing any, too much liquid nutrition or too much fats and things like that because they're harder to digest. The liquid nutrition doesn't really help absorb medication. So as I, eventually start weaning off the medication, I can start going into, easing into. I'm not jumping in with, I'm not going into it too hard. So I'm just being really smart about it. So today, last night, sleep-wise, it was really hard to get comfortable, to figure out, I'm not a back sleeper. I'm a side sleeper, like a side and hips. Like I sleep partially on my side and my stomach. So it was really uncomfortable to try to find a spot to go to sleep. I had some trouble throughout the night. When I got home, breathing and getting stuffed up, and stuff was breaking up, and I needed to expel a lot of mucus, which is just part of your body expelling the chemicals, the anesthesia, and this is going to continue for a while. And I will do some things to help continue that to go faster. Herbs, activated charcoal to help get those out of the system quickly. So I got about an 8-hour night's sleep last night, which is really good. Felt fairly good in the morning. Again, waves of pain and discomfort and gas and bloating and just bladder pressure. That's throughout the day. That's just not better than yesterday. It's just a continuous thing for now. Definitely need to have a bowel movement, so I'm probably going to have some herbal tea to help stimulate that closer to bedtime, so maybe by the morning I will have a nice bowel movement, or early afternoon. It's been a few days, which they said is not uncommon because you do a bowel prep before, and then you have surgery and things get sleepy and sluggish. So now we're into day 3, which is Monday. I've been home a full day now. So I got up, had some coffee, had a small bowl of hot cereal with some fruit for breakfast, had a second cup of coffee, had some greens powder with magnesium to help with the bowels, BCAAs, which is your amino acids, to help with recovery. And then for lunch, had soup again, had the soup and toast again. And for lunch, after lunch, I try to correlate my food with my pain medication. And then shortly after lunch, I lay down for about an hour, hour and a half. I probably slept about an hour, hour and a half, but it was just a lot of just rest, which is important. Before I talk to you guys, I had a quick snack of plain unsalted rice cakes with some cashew cream cheese on it, and a Zevia ginger ale because I'm super gassy, TMI. And incision looks great every time I look at it or have Mark look at it. A little bit of bruising. There's no seepage or weeping or anything. Definitely don't want no signs of infection or anything like that. But definitely some noticeable bruising in areas or parts, which is not uncommon. And the one side, it's definitely correlates with the fact that it might be because of the extra blood loss from losing my right ovary. So I just wanted to get on and touch base with you guys since I'm feeling pretty good. I had a moment. Mark stepped out. He's just going to take some time away and go to the gym, get his mental health in and get his workout in. And we're very understanding of that. It's been really hard. Not really hard, but at times it's hard to accept help or to ask. You just feel like you're saying, could you please get me this? Could you please get me that? When you're so used to just getting up and getting it yourself. But that's why he's here. He's here to help and support me and take care of me, make sure I'm okay. Moving around. I definitely have my belly binder on. They put one on at the hospital, which gave me lots of support, and then I had to take it off because when the doctor took the bandage off, there wasn't really anything to buffer that zone, and having to get up so often that second day and constantly urinating was a bit of a problem, so I left the binder off. But the binder's been a big support. I wore it to bed last night. I've been wearing it most of the day today, let my incision breathe. I was able to shower today, which was great. By myself, I didn't need any help, just took it really slow and really smart. Use some essential oils mixed with coconut oil on and around the incision to help prevent infection and just to help with healing. I've been using tea tree and clary sage and lavender oil. And it also helps with just my state of mind, my pain. It just helps. And I like my essential oils. I use those day 2 in the hospital, like on my knees, things that I could reach pretty easily without too much pain or discomfort. I'm able to brush my own hair and lift my arms up on my head. I've had a lot of gas, but I haven't had any of my gas is mostly under my chest and below. And it's moving, which is good. You want bowel movement, you want bowel sounds, you want stomach sounds. But it's just getting it out. So being able to move the gas that builds up is important. So the next step is just to have that bowel movement, which is even just as important to help, move those toxins out, right? Get them out of the system. So I will continue doing my rotation of Motrin and Tylenol as needed. Herbal supplements, I did my milk thistle and dandelion this morning. I did my greens powder with magnesium and my branched chain amino acids. I did some activated charcoal yesterday, which really helped with the gas and bloating. I'll probably do that again. Again, that has to be timed with like before food to a certain degree and after food. I also started my serapeptase up. So yesterday my serapeptase I took before we left the hospital, because you want to eat that again 2 hours post a meal or before a meal. That is also an anti-inflammatic, helps with pain, and will help break up any scar tissue, build up blood. It feeds off the dead and senescent tissue, so it'll help with the healing and recovery process as well. So I will continue with those particular supplements, herbals, and green powders. Just like I said, I had the rice cakes and the Zevia. I might have a piece of fruit. Definitely a little bit more like appetite is up a little bit more. And then I'll try to not eat too close to bed, because that can, with the gas and bloating, can prevent issues or have issues with sleeping. So what else is there to talk about for day 3 post-op? Belly band has been amazing. I got a high-waisted maternity. You can use them for post-op C-section and hysterectomies, undergarments. So they've been great to help with support. I have a lot more support. I have my little tummy pillow that they give you at the hospital. Actually, I'm using it here. I'm using another pillow here. They can use anytime you cough or anything. So it's important to cough and to move your lungs so you don't get pneumonia. So I think that's just all of that I wanted to update you guys with right now that I can think of. Again, I might forget some stuff, or might have forgotten some stuff. So hopefully this will help you and other ladies out there that have, are looking for information to research. Even when those days when it feels like it couldn't get worse, but it does get worse, there's always light at the end of the tunnel, okay? We always feel the worst when we're in the worst, right? We're in that darkness and that pain and that whatever you're going through. But you do come out of it on the other side stronger, better, and healthier. I mean, there's reasons why we have to have these surgeries done. It's usually because there's risks of cancers. You have excessive fibroids, endometriosis, or things like that. So there's a reason for why this has to be done. And it's very common. It's very, very common for women. So I just wanted to say, hey, this is day 3 post-op, total complete abdominal hysterectomy, and ended up having to have a right side oophorectomy. So I hope you guys have an amazing day. I will talk to you later. Bye, guys.